Alright. Okay, I walked in the room, I knocked on the door, introduced myself, and I washed my hands. Van, make sure that it's the right baby and everything. Yep, it's good. Now I'm gonna look at vital signs. First I'm gonna do temperature, which I would stick under the arm and then hold the arm there, or use a temporal monitor. Pulse, I'm gonna do an apical pulse, so I'm gonna listen for a full minute. And then for respirations, I'll just feel the chest rising and then count that. Alrighty. And then heart sounds, I would just listen to that. Okay, oh wait, gotta do the vowel sounds too. Okay, and it was regular heart sounds, the breath sounds were clear and equal. And through this entire process, I'm gonna try to keep baby as warm as I can. Next thing I'm going to do is look at the head, checking for any molding or any abnormalities with it. I'm going to look at the fontanelles and the suture lines, and everything is regular with the baby. And then I'm going to go ahead and check eye placement, and everything's symmetrical. Checking the sclera of the eyes, make sure there's no drainage or anything abnormal with it, and everything looks good. And looking at the epicanthal folds, and everything's good with that. Ears, I'm just going to look at positioning, so I'm measuring that up with the corners of the eye. Everything looks good. I would do the cartilage check just to make sure that it doesn't show any signs of prematurity. So I'd fold that up, see if it recoils, and same with the other end of the ear. Nose, I'm looking for patency with it, and I'm just going to plug one nostril, see if the baby can breathe out of that, and then plug the other. With the mouth, I would put gloves on. I'm going to. Okay, so with the mouth, I would try to, figure out a way to get my finger in there, kind of like rubbing the sides of their mouth, helping them learn how to open. And then I would put my finger in there, checking the roof of the mouth to make sure that it's been developed properly, and also checking suctioning to make sure the baby can suck right. Okay, and then the next is going to be the neck, where I'm looking for any masses of any kind, and then also doing ROM, where I would help turn the baby's head to the side, and this baby down, there we go, gentle. Okay, good. And then looking at the clavicles and just palpating, noticing any abnormalities, but everything's regular. And then with the skin, I'm just checking to make sure that there's no bruises or anything like that. And undress the baby, maybe. You can get them off the baby. Well, originally I would undress the baby, and I'm just checking the skin to make sure there's no lanugo skin or skin tears or anything like that. Everything looks good. Things regular. I check the skin turgor, and where you just hold up like that, and you can do it on the abdomen or like on the thigh, and you want it to fall down fast, so that deep risk. The skin is blemish free, and I would check the back for lanugo. So I can breathe. Okay. No lanugo, nothing like that on the back. Right. Baby likes to take its blanket with him. Okay. And then I'm gonna check for. Okay. Can you pause it?
So.
Alright, and then I'm gonna check for jaundice, and there's 5 areas to check for that. You look at the forehead and you kind of blanch the skin to see if there's any jaundice there. Then you look at the chest and you do the same. You're looking at the belly and blanching that again. You also have the inner thighs, and do that as well. And then one of the other places is the sclera, just making sure that you don't see any jaundice in that either. And then the other thing that I'm looking at is respiratory distress, which there are 5 signs of that. You want to make sure, first of all, that the baby has no labored breathing, which this baby has unlabored breathing. Checking to make sure there's no nasal flaring, no retractions, grunting, no seesaw respirations, and baby doesn't have any apnea. And then looking at the abdomen, the baby has a normal shaped abdomen and it is soft, which look at the genitalias of the baby. But first I'm going to put gloves on. Okay, no, that's not supposed to happen. And then I'm looking at the labias, the majora and the minor, looking to see if there's any abnormal discharge, yep. Okay. All right, and then I'm gonna take these off. Pause it for a second. Okay, so I'm checking tone, and all I'm gonna do is take the baby's arm and bend it back, and then let it come back in. She did good with that. And then looking at the palmar creases and the digits, she's got all the palmar creases and all her digits, all her fingers. And I would open this side up to make sure it's all there, and then check to make sure her fingers are there as well. And then I'm going to look at her feet. Again, all the creases are there, and all the toes are there. And then next I'm going to look at her spine. Okay. And I'm going to put gloves on this because I'm going to check the spine and look at the sacral area for any hair tuft, and then also the symmetry of the hips. Okay, so just going down. Okay. Everything looks good. She doesn't have any hair tuft or dimples or anything like that. The symmetry of her hips are great. They're symmetrical. And then take these off, put the baby back on her side, of course supporting the head. Okay. And then next I'm going to do the Moro reflex, where either you tap the side of the crib that the baby's in, or you can clap your hands and the baby's supposed to react, and she did. So I clapped my hands. And then behavior, I'm just listening to the infant's voice to make sure that there's nothing abnormal about that. And then I would also ask the mother about when the recent stools were, how they've been looking, because it's important to see how those are doing. And then the voids also, and make sure that the baby's not due to feed or anything. So you ask the mother when she last breastfed.